Welcome everyone. My name is Blake and I will be your moderator. I'm excited to welcome Dr. Halpern as she discusses her step-by-step restorative workflow. Before we get started, I'd like to take a moment to go over some housekeeping. This webinar is sponsored by Kuraray. Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand. Welcome and thank you for being with us. I will pass it over to you now.
Welcome everyone, and thanks so much for joining me today. Special thanks to Henry Schein for sponsoring this webinar. I'm excited to have the opportunity to spend the next hour or so with you speaking about a CAD/CAM block that has been a great addition to my routine clinical workflow over the past couple of years, KATANA STML. So what do we look for in our chair-side ceramic blocks? We're always in pursuit of the perfect marriage between strength and aesthetics. As CAD/CAM doctors, we always must consider the third important factor, our chairside time, right? Especially when we are striving to deliver our restorations in one appointment or a single visit. So when I'm starting to evaluate which material to use when, I'm always looking to find the best balance of all three. Strength is still the #1 reported feature that clinicians look for in CAD/CAM blocks. So for today's presentation, let's focus on one of the strongest chairside materials we have available, which is our translucent zirconia blocks. So KATANA STML entered the scene in 2018. It was the first multi-layered zirconia block for CEREC designed to deliver aesthetic restoration chairside in a single appointment. And it's found a permanent home in my practice the past few years. I really like the translucent zirconia blocks like KATANA because they provide high strength without having to compromise the aesthetics of our restorations. So as a beta tester for the Prime Mill and having early access back in 2019, it opened up doors for me and enabled me to introduce KATANA into my chairside workflow. So prior to that, I was using zirconia on occasion for second molars, and I would have my lab fabricate the crowns for me. And this was because I had an MCXL, it's a wet mill, and the time it would have taken me to wet mill, then dry, and then the longer sintering processing times that were available back then, it just really wasn't conducive to a single visit workflow. So being able to now fast mill KATANA in the Prime Mill and sinter it in as little as 18 minutes has really been a game changer for me. And I can honestly share with you that having been using KATANA now in my practice since 2019, I have had 0 debonds and 0 fractures, which is really, truly remarkable. So KATANA is a multi-layered block. It has 4 layers within the block. And what's great about that is it allows us to take advantage and alter the chroma by just altering the position of the restoration in the block in the manufacturing phase. So you have the enamel layer, and then you're going to have a transition 1 and 2 layers, and then we have a body layer. And each of these layers, they don't have any difference in strength, and there's no gradation gaps. So it's a similar concept when we have our glass ceramic multi-blocks like at Empress Multi, where we have these different layers, and we could take advantage of this. And often it may eliminate our desire to stain and glaze the case because we have the ability to get this polychromatic effect. So why KATANA? Well, first, it has excellent margins, and it has a high strength at 750 megapascals, which allows us to be more conservative in our preparations. It mills out 25% larger because that's how all zirconia is milled. And what that does is eliminate over milling. And we have, in the Prime Mill, we have the ability now to mill it on more different modes. We could do it in super fast, fast, or extra fine. what's also great is it can be cemented or it can be bonded. And yes, we can bond zirconia, which I'm going to show you later on how we do that. Soft tissues love polished zirconia. So whether it be a crown or even an implant restoration or a pontic site under a bridge, if you're seeing it on recoil, you'll be very impressed on how the soft tissue responds. And with KATANA, again, it's multi-translucent, so we're taking a historically maybe more unaesthetic material like zirconia and getting back the look of a more authentic natural tooth. So one thing worth noting that is with all zirconia and KATANA is that it's going to look radiopaque on the x-ray. So if you see here on number 14, you see that's a bonded KATANA restoration. So that's something that it's not a deal breaker for me. I still use zirconia and I like to use KATANA routinely in my practice, but it's kind of similar like when we always had PFM crowns or gold crowns. We couldn't see through those restorations on x-rays either. That being said, on occasion I will consider if a patient is a really high caries risk and I want to be able to see through their restorations. On a case-by-case basis, I may say that that's not necessarily the best fit. Also with KATANA, you want to note that Kuraray does recommend dry milling, and you do have to have a sintering furnace to chairside KATANA. So we have currently with KATANA STML, we have 14 shades available. There's the 13 Vita shades, there's a natural white, the NW bleached shade, and it comes in multiple sizes. There's a 12Z, a 14Z, and the bridge block, which is the 14ZL. Preparation guidelines. So when we're looking at our preparation design for our anterior crowns, you're going to need a 0.8 millimeter thickness on the incisal, facial, and lingual. For our veneer preparation, we're as thin as a 0.4 millimeter. And for our inlays, onlays restoration, 1 millimeter in the cuspal reduction and the isthmus. And then for our posterior crowns, 1 millimeter. So Kuraray recommends that you do either a chamfer or shoulder margin. I know that it's very popular now. A lot of doctors are looking to do feather margins or verti preps. And it's just something that you have to be aware of if you do elect to do that type of preparation design. There is going to be an increased risk of chipping during the mill. As far as for the posteriors, you're going to want to take a 1 to 1.5 millimeter occlusal depth cut to get to the ideal proper occlusal anatomy. Minimal thickness is going to be set at 1 millimeter. Your margin thickness parameter is set to 100 micrometers. And we want our chamfer reduction to be 0.8 to 1 millimeter. And the taper for our axial is going to be 6 to 8 degrees. So let me share with you my workflow, my chairside workflow for KATANA. So my process, we'll seat the patient, get the injection, get the local anesthetic taken care of. Once I have already decided the shade, if I even know it from a previous case on the same patient, I can in advance have my assistant go ahead and put the block in the prime mill and start what's called the touch process, which does save time later on in the workflow when we're actually manufacturing the restoration by not having to first do it then. We're going to prep the case, scan the case, and depending on each doctor is going to have a variation of how long they spend on this first part of the process, but I'm averaging anywhere between 20 to 30 minutes. And then once we get into the scan is complete, we do the design. I do spend quite a bit on my designs. I do take full arch scans routinely. I also use the virtual articulator in my cases. And so for me, I'm still around 5 to 7 minutes. And then we have, depending on which milling mode we're going to use for KATANA in the prime mill, if it's a super fast, it's about 4 minutes. If it's fast, about 8.5 to 9 minutes. And then I have to remove the sprue and pre-polish, so figure another 3 minutes for that. And then the sintering and cooling, that's going to run about 20 minutes. And then if we're going to just try it in, polish, and deliver, factor about 10 minutes for that. So the total treatment time, if I'm doing a polished zirconia KATANA restoration, is anywhere between an hour, say, to an hour and 20 minutes, which is a game changer to be able to deliver zirconia this efficiently. So this is what it's going to look like when you're in the software. When you're in the admin phase to start the process of designing KATANA, you're going to make sure that you go into, under the material, you want to choose Kuraray Noritake, and then choose KATANA STML milling from the drop-down menu. And now in this screen, if we look at the manufacturer screen, you'll see here that in this case, I had a 12Z KATANA STML block installed for this restoration. And you'll see that because I have the 12Z block, you're going to see super fast, fine, and extra fine milling modes are available. Now, if you look at this screen, you'll see the restoration is now a 14Z block. You'll note that the milling options have changed. So in this screen, you'll see there's no longer the super fast milling mode available. And that's because the super fast option for KATANA STML is only available for the 12Z. So if you have a restoration that needs to be in a 14Z, or you only stock a 14Z block, then you will not have the super fast option available. So that being said, soon we'll have available the new KATANA 1 block, and that's going to correct for this. But you do, for that, when that block is available, you will have to have the latest 5.2.4 chairside software to have access to that block. So now we take a look. This is what this screen looks like in the prime mill, and we have the KATANA STML block loaded. It's already, the touch process has been completed, so you'll see it lists that it's Kuraray Noritake STML 14Z and the shade A2. And this is the tool set for milling super fast. They're carbide burrs, and they do what's called parallel milling. So what that means is we have 2 sets of each burr, a shaper and a finisher, and that's why it cuts down the time. So I mentioned earlier, dry milling versus wet milling. I always now am doing 100% dry milling of my KATANA in the prime mill, and Kuraray does recommend dry milling. If you are choosing to do wet milling, you just want to be conscious that you use a different water tank for your glass versus your zirconia, because if wet milling gets contaminated with silica-based glass like Emax, the translucency can be affected. So in the prime mill, this is what the screen looks like once you go to install the block. If you click this button OK to do the touch process, that's going to get the machine completely ready so that by the time you're done designing, prepping the case, you're going to save time off the actual milling. I wanted to compare and contrast some of these milling options. I went ahead and I did mill out a KATANA STML 14Z A2 because it was a 14, so it was done in the fast mode. And I timed it, and it was a little under the 9-minute mark. And then I went ahead and changed the tools in the prime mill to what's known as the mill zirconia extra fine mode. And now you'll see here the difference is instead of having the 2 sets of the same shaper and finisher, now we have a 0.5 CS smaller diameter tool that's doing the extra fine milling. So this is what the tool set looks like installed. And you'll also notice in the prime mill, you get to see the countdown of how much % life or usage each tool has. And the question has come up frequently as to when to change the tools. And it's recommended around the 30% mark. Now, obviously, there's doctors that push it and you can continue to mill at 1%, but you're running a risk at that point of longer time. It potentially could break the tool during the mill and get interrupted. And for me, I'm all about trying to be as efficient as I can. And I don't want to leave to go do a hygiene check and then worry that I come back and that I lost time or that I have to change a tool in the middle of the process. So I went ahead and then I used this same restoration and I milled it again in the extra fine. So here we have the KATANA STML 14Z, again, A2, and extra fine for comparison's sake. And this one took about a little over 14 minutes to mill out. Let's take a look at how they compare next to one another. The one on the left, that is the fast, and the restoration on the right, that is with the extra fine. So you definitely can appreciate that the extra fine does give you much more detail in our fissures and our occlusal anatomy. And now we have to start to explore, when does that make sense to employ the extra fine and spend the extra time to do it? So for me, I found that for my daily single visit bread and butter restorations with KATANA, I'm gonna usually prefer to do the super fast or fast. And when I would want this extra anatomy or detail in the mill would be on a case that's not a single appointment, a case that maybe is multiple unit, anterior case, or a bridge where I want to get more of that anatomy. Because interesting enough, if you look at this slide, you'll see the slide on the left, that is, again, the fast, versus the one, the restoration on the right is the extra fine. And you can see the intaglio is comparable in both. The margins mill without chipping. So you're not really going to notice a difference in the mill from the fast versus extra fine in regards to the margin and the intaglio. It's really going to be in the extra enhancement of that occlusal anatomy. Wanted to now go over how we can finish KATANA STML and the way different options that we have available to take it from the mill to the mouth. So here, this is an image now of another KATANA restoration that was milled out on super fast. And you'll see that when you do use super fast, you're going to see more burr marks on the restoration right outside of the mill, but it's very easy to polish it. And it's not time consuming, and you still have a lot of options to bring this restoration to the level we want. So what I always love to use to finish all of my KATANA and Zirconia cases is this Meisinger Lab kit. It's called the JK04. It's by Dr. James Klim, who's one of my dear friends and mentors, and I just absolutely love this kit. So first, as soon as the restoration comes out of the mill, we're going to have to separate the restoration from the block. A couple things with this. You want to wear gloves to prevent any contamination from our oils on our hands. Also, you should really be wearing eye protection and an N95 respirator to protect yourself from inhaling any of the zirconia dust while we're working. And from this kit, we're going to take out the carbide birds, the HM498 FX023 carbide, and carefully you want to make sure that you're bracing the block with one hand, and your dominant hand is holding the restoration, and then you're just going to slowly use this tool to separate it from the block, because you don't want to obviously take a chance of dropping the material at this state. It's very fragile. So once we've separated the restoration from the block, I will take the carbide burr that's from the kit, that's the HM78MF023. Now, with both separating from the block and starting to remove the remnants of the sprue, we're going to use a lap hand piece, and it's at about 10,000 RPM to remove it. And now I do like to pre-polish my KATANA cases. So I will pre-polish to a luster using a pink twist from the kit. That's the 97699M. And then I will follow up with a beige twist polisher. And with that, you really want to be very little pressure when you're doing this. You're doing very light feather touch. So you're not doing any extra stress to the restoration. And I will mention that I don't also polish with the pre-polishing my contacts because I don't want to inadvertently lighten them during this process. Once I pre-polished, now I'm going to use a brush, and you want to remove all of the zirconia particles prior to sintering. So you're going to brush the intaglio and the external surface of the restoration. And now it's ready to get into the sintering process. So you're going to place it in, this is the CEREC Speedfire with the intaglio side up. So for posterior restorations, again, always the intaglio side up or occlusal side down, and you're going to have an 18-minute sinter after the dry milling. You can actually sinter up to 3 restorations at once, but you just have to make sure you select multiple jobs. And that's it coming out of the Speedfire. And at that point, then you're just going to take it and put it on the cooling area in the Speedfire and let it cool for a few minutes before you attempt to touch it. Okay, so once we have now sintered the restoration and we're doing any post-polishing, it is easy to over polish zirconia, and when this happens, what it starts to look at is the restoration will start to look too pearly. So if that happens, it can easily be corrected. So how do we do that? You're going to sandblast the surface with 30 to 70 micron aluminum oxide, then just steam clean it, and then go ahead and repolish it. So this is my micro etcher. I use the Danville micro etcher, and it's 30 to 50 micron aluminum oxide. When you go ahead and do sandblast, you're going to note that the surface will not look different. And now that's that same restoration after I did correct for that pearly appearance. For post-polishing, after it's been sintered, from that same kit I showed earlier, I like to use the Blue Twist 97771M260. And then I love using a Robinson brush with a Schein Fine polishing paste. So here's a couple examples. On the left, the molar. These are just no glaze, no stain. They're just polished and sintered. On the left, we have an A2 example, and then a C2, and then the anterior crown, same thing, A2, C2. So I think this is a good illustration to really see the chroma and the multi-layering of this block, because these are not stained and glazed, and you can see how they have a polychromatic appearance because of these different chroma gradients within the block. Now we have options. So you can choose to polish KATANA, or you can choose to stain and glaze it. So this is the CZR products. They're the CZR glaze, paste, and stains for KATANA. And you're also going to need to put it on a firing pin if you're using the speed fire. And I like to use the Ceric Speed paste. And here are the brushes that I like to use for my staining and glazing. And they are the Syntec brushes from Smileline USA. Regarding the brushes, if you take good care of them, they'll last. I never use water to clean my brushes. I'll always use 91% isopropyl alcohol. So let me just walk you through my process when I'm applying the stain and glaze to a KATANA restoration. So first, after I've polished, so I've done my post-sintered polishing, then I'm going ahead and I'm going to sandblast the surface of the restoration with 30 to 50 micron aluminum oxide. I'm going to sandblast all the surfaces except for the occlusal contact areas. So anything that's going to be occluding against the opposing tooth, that area I'm not going to sandblast. And then I will clean it with steam cleaner or alcohol, and then apply a thin coat of the clear glaze liquid. And from there, I will coat the crown with a layer of the glaze. And for staining, I will apply the red-brown into the fissures and the central fossa. And when I'm doing this, I'm not trying to make the tooth look stained or dirty, but I'm trying to give the illusion that it's a natural tooth. And when we do these stains inside the fissures, it creates the illusion of depth. And then I'll apply a gray-blue, the grayish-blue stain onto the cuspal areas, because that gives the effect of enamel translucency and the optical illusion that it's translucent. And then we'll add some white. White creates highlights, so I would put the white or ivory on the lobes and the marginal ridges. And then I go ahead and I will apply some warmth and chroma to the gingival cervical third to give a more natural appearance. So in this case, because it was an A restoration, we applied the A+. And this is how side by side they compare to one another. On the left, you'll see that's polished only, same shade, KATANA STML A2, and then versus the stain and glazed. I will tell you, I always prefer the aesthetics from restorations that are stain and glazed and compared to polished. But I do think that polished only has a time and place. If you're doing a case that the aesthetic demands are low, or the patient can't sit in the chair for a long period of time, if they're elderly, or they have any other disabilities, then, and it's a second molar, at that point, then you have to weigh out the risk benefit of the extra time you're going to spend on the glaze if it's really not something that's going to be visible or concerning to the patient. Okay. Let's talk about bonding zirconia, bonding KATANA. Zirconia bonding. Can we do it? Yes, we can. This is how it's done. First, we're going to micro etch the intaglio. So we're using that same Danville micro etcher at 30 to 50 micron aluminum oxide. And just like I mentioned earlier when we were prepping the restoration for the stain and glaze application with the micro etching, when you micro etch the intaglio, the surface is not going to look different. After micro etching, and then if you're trying in the case after you've micro etched, then you want to go ahead and clean the restoration either with KATANA cleaner, or you could use, if you don't have KATANA cleaner, an ultrasonic bath for 2 minutes, or you can steam clean it. Now, this step is also contingent upon whether or not you have the micro etcher chair side or in your lab and the sequence you're doing it. So for me, I will try in the restoration, then check the contacts, make any adjustments, and then I will do the micro etch after it's been in the patient's mouth. So since I'm micro etching after the try-in, I don't need to do this additional cleaning step. However, if you're micro etching it in the lab after it's come out of your furnace and then trying it in the mouth, if it's been in the mouth after you've micro etched, then you definitely want to proceed with this cleaning step. Now, to bond to the tooth, we have to apply a clear fill universal quick bond to the prep, and you're going to air dry it. And the last step is our cement. So I'm using the Panavia SA Universal Cement, and it's important to note the reason it's bonding is because Kuraray has placed their MDP, which is the ingredient necessary to bond zirconia, in the actual cement. So the MDP for chemical bonding is in the Panavia Universal Cement, and you'll have a chemical cure that happens between 2 to 4 minutes. So you don't need an additional primer because the MDP is in the cement. Let's take a look at some clinical examples and clinical cases. So here, this was a case I did of 2 molars, both milled in the prime mill on super fast, less than 4 minutes each, KATANA STML A2, and in this case, I did not stain and glaze. So this is just pre and post sinter polish. So a really great result, very efficient, still rivaling the crown. That's a ceramic crown adjacent to it. So you can see how close and how far zirconia and this multi-translucent block has put us back into a realm of competing with our other glass ceramics as far as the appearance of it. And then you'll see in this slide as well, you can note how nice it mills. You really can see there's no chipping and how crisp and clean those margins look. And here's another case. So this was a case that was prepared for a crown on the tooth number 14, the upper left molar. And for this case, I wanted to play with comparing and contrasting different milling time modes versus polish and stain and glaze. So here you'll see on the left, I milled that restoration out on fast mill. That was about almost 9 minutes. And then I just polished it and sintered it. So that whole time took me a little over 30 minutes. And then I said, well, let's see what if I wanted to go all out and use the best milling and stain and glaze application. Let's see how much time that would take. And I got to a little over 14 minutes for the extra fine mill. The sintering was about 18 minutes. And then the time it takes to apply the stain and glaze. And then in this case, I fired it in my speed fire. So when you're firing the stain and glaze in the speed fire, it is going to take quite a bit of extra time if you're trying to do it immediately after you've sintered it, because the oven has to cool down from the sintering temperature and then do the glazing. So that's why you're getting this extra time of 21 minutes. So there is a little bit of, we have a few options with this. Instead of firing it in the speed fire, if you have another oven, like I have a CS oven, you can fire KATANA stain and glaze in a cycle in that oven, and that will shave time. It's probably around 11 minutes for that. So you can cut down time if you want to use this process. But I was doing this exercise because I really wanted to see, for me clinically, where I would want to decide what parts of this workflow are worth the time. So for me, I have found routinely now that my go-to is to try to do super fast mill for KATANA, and then I will do my pre and post polishing, and then stain and glaze. So I really like staining and glazing, so I do a lot of the times will stain and glaze when the case permits, but I will shave off the time in the mill. So this is a side-by-side comparison of that same restoration now back in the mouth. So again, for me, I still think that the stain and glaze, the appearance of the stain and glaze restoration is superior to the polish only. Does it matter in every case? No. But if you're going to say which is better, I think that the photograph kind of speaks for itself. But as far as the extra fine, I think that I can get the appearance of nice anatomy with the stain and glaze and shave off time with the extra fine mill for the extra fissures and save that for an indirect, a second visit case or a larger case or a bridge case of those types of things. Okay, so showed you some cases for KATANA STML on the posterior, but what about for our anteriors? So you can see that KATANA STML has certainly been a great addition for all our bread and butter posterior cases. Can it be aesthetic in the anterior? If you were to ask me a few years ago if I would consider using zirconia restorations in the anterior, my answer would be a quick and firm no way. And this is why I really love the evolution of our technologies and materials with CAD/CAM. Never say never. Materials are constantly improving, and I really wanted to take the opportunity to share with you a case where I used KATANA in the anterior. Okay, so why did I choose KATANA for this case? Why not another very aesthetic glass ceramic like a lithium disilicate or even a lucite reinforced ceramic? We have so many great options, and I really do enjoy using different materials based on the specific case requirements and parameters. So let me show you and walk through this case. So this was a patient who came to me and she had failing veneers that were fractured. They had recurrent decay. She had some composites on the lingual that was also showing signs of leakage. Then she has a deep bite. She has significant attrition and wear. She has a history of bruxing, and she's missing all her left maxillary posteriors. So she doesn't even have posterior occlusion. Here is her the view of those restorations from the palatal, and you can see that they're wrapped. There's quite a bit of preparation on the lingual, and there's some composites as well. Okay, and of course she is a patient who she did not consent to restoring her posterior occlusion. She does not want to do any other of the ideal treatment to balance her bite, and I was now forced, because of this fracture and because of the caries, to try to come up with a resolution for her case that was going to be predictable. So I needed a material that was strong, but I also didn't want to compromise the aesthetics. And I needed a material that could be super thin with a minimal occlusal thickness, and then being able to tolerate these additional occlusal forces from parafunction and from the lack of the posterior occlusion. So with her case, I did scan her in my prime scan. I took full arch upper and lower scans, a bilateral buccal bite registration, and then I sent the case via CereConnect to my technician, who did a digital diagnostic wax up for full coverage crowns for 7, 8, 9, and 10. And then this is a printed set of models of the digital diagnostic wax up. And from there, we used that to create this putty that I was going to use to provisionalize the case. Here are the preparations. So the patient's old veneers were removed, the caries and the decay were excavated, and some core buildups were placed using Kuraray SC Protect and the APX composite. And a conservative smooth chamfer margin was placed for full coverage crowns on 7, 8, 9, and 10. Then we took my shade photos. You could see that the shade of the preparations were quite dark, and that was something that we were going to need to also consider in our material choice as well. If you look here, this is what now it looks like after I've scanned the vinyl preps into the prime scan, and I also did scan the biocopy of the digital wax up. This is the image of the preps scanned. I did use, in this case, I did use an Ultradent packing cord. It was a 000, and I took the counter and the buccal bite. And that's the preps mounted with the buccal bite. And then I fabricated some provisionals for this case using that putty index with Luxatemp, and I cemented it with Duralon, which is my routine go-to for in cases that I am provisionalizing. Duralon is very kind to the soft tissues, and when you're doing your temps, always make sure you open those gingival embrasures. Don't choke the papilla. Leave adequate space. Put little black triangles in on purpose. That will also help with the patient's hygiene, but it will also tremendously help prevent any inflammation of the tissue. So when the patient returns for you to bond in the case, you're not battling tissue that's inflamed or bleeding. So these were the provisionals when she left that day. And now let's take a look at the restorations. So these are some images I took on the bench of the KATANA STML crowns on the printed model of the preps. And I think that if I didn't tell you what type of material this was in this image, I think a lot of doctors would look at this case and easily be convinced that it was a glass ceramic. So I think it's remarkable to look and see how aesthetic KATANA can be and how it really does rival some of our glass options. Now, am I saying that I'm using it for all my anterior cases? No, I still use my glass ceramics all day, all the time. But when we have these cases that we have these certain parameters for, it's great to know that this is another viable option that we can still get great results with. So Panavia, I was using the Panavia V5 cement system to bond in this case, and it comes with tri-and paste, so you can use different shade values of the resin cement to determine what the tri-and paste to determine which shade you want to use in your cement. So we did try in a few different shades to see how it impacted the restoration, and the patient was actually given a mirror and allowed to give a feedback, and we did decide that we liked the clear, and this is what the patient chose, and I thought that it was the right choice, so that's what we went ahead with for the final cementation. So these are the final KATANA STML restorations that are seated. And now this is her before and after. Another view. So I would like to tell you that zirconia has certainly come a long way, and it definitely is KATANA is a great alternative option for the anterior as well. Okay, so today we looked at the latest in milling technology, clinical applications of chairside multi-translucent zirconia, and techniques for the best results. This concludes my presentation today. Thank you so much for joining me. Please feel free to reach out with any questions you may have, and I look forward to seeing you next time. Take care.
Thank you so much for joining us tonight. We did record today's webinar and will email out the recording sometime in the next week. We would appreciate your feedback via our survey that will pop up on your screen shortly. Thanks again for joining us, and we look forward to seeing you on future webinars.